Let's talk about vocal cord dysfunction, also called inducible laryngeal obstruction. Your vocal cords are bands of muscle inside your voice box, or what is also called larynx. In vocal cord dysfunction, your voice box is not working as it should. It's not opening correctly. Normally, when you breathe, your vocal folds should open, and when you talk, they should close. In this disorder, vocal cord dysfunction, your voice box tends to do the opposite, as it closes when you breathe in instead of remaining open as it normally should. This is often misdiagnosed. Many providers are not even aware of this disorder, and it can also mimic asthma. Some studies actually report that approximately 40% of patients who have this disorder are misdiagnosed with asthma. It often gets mistaken for asthma because it can present very similar, especially with the symptoms. They also have similar triggers for the flares. And to make it even more difficult to diagnose, you can actually have them both. But a key difference is in the pathophysiology. In asthma, it's your bronchial tubes that are constricting, aka tightening. And vocal cord dysfunction is actually your vocal cord muscles that are tightening. Another key difference is that in vocal cord dysfunction, it's hard to breathe in more than it is to breathe out. And in asthma, it's harder to breathe out more than it is to breathe in. It is a condition that can't be cured, but it can be treated, so that's good news. It's seen more often in females, particularly in the ages 20 to 40. Some of the symptoms that individuals will complain of include things that are very similar, as I said before, to asthma, like chronic coughing, chest tightness, wheezing, shortness of breath. In addition, these individuals often have hoarse voice, like myself, throat tightness, difficulties breathing in. They also may feel like they need to clear their throat often, or feel like they have a lump inside their throat. They may have their wheezing or a stridor-like noise when they breathe in is usually higher up. They'll complain it more in their throat area. They may also feel kind of like they're choking as well. The flares can mimic asthma attacks, so it's important to realize that. Some things that can trigger this include things like acid reflux or GERD, irritants from outside pollutants, viral infections, and even exercising. And these are all things that also can flare asthma attacks, lead to asthma attacks. How to diagnose this? Allergist, immunologist, ENT, these are all specialists that can help to diagnose this. Laryngoscopy, that's a scope that basically you can get done. Spirometry, that can help to measure airflow in. Pulmonary function tests, they actually give an overall picture of the respiratory tract, how it's functioning. And then the treatment, it kind of depends on what the triggers are. You typically will go to speech therapy. You'll also have respiratory retraining therapy, basically learning breathing techniques. And then, as I mentioned about the triggers, often treating things like GERD and allergies can help to improve this. Well, I hope this helps, and make sure to follow along for more medical information.